In a world where mental health issues are becoming increasingly prevalent, the urgency to bridge the gap in medical practice and elevate psychiatric care has never been greater. Ghana is confronting a growing mental health crisis, yet the nation faces a dire shortage of specialists equipped to address these complex conditions. Now, as part of efforts to address the challenge, the Mental Health Authority, in collaboration with the Psychiatric Department of Dalhousie University in Canada, the Ghana College of Physicians and Surgeons, and the University of Ghana's Psychiatric Department have begun specialized training sessions to help build a robust network of skilled professionals dedicated to mental health. Now, we'll be engaging them shortly on the show, but first, our research team has put together some data on Ghana's mental health outlook, and it's coming on your screen shortly. Well, that's what you have it, the global mental health and the share of global disease burden. That's 10% for Ghana, and mental disorders is 10%. If you could see the yellow marking in the pie chart, we stand at 10% when it comes to mental disorders as Ghana as a country, and the rest is for others. Now, when you come down to low and middle income countries, you could see not receiving treatment accounts for 75%. That's quite a lot. And for those of them who have access to treatment, we have 25%. Now, people living with mental health conditions in Ghana, we have 2.3 million. That's quite the number. And as a population, you know that we're over 30 million. And so it puts it into perspective, the conversation we're about to have, and why it's important that we have this conversation. So that's our outlook. We're focusing on Ghana. Now, only 2% of this 2.3 million are receiving treatment. That's sad, and that's the reason why we want to have this conversation this morning here on Newsdesk. Now, I have with me Dr. Ejapon, Professor and Head of the Department of Psychiatry at Dalhousie University and Chief of Psychiatry for Nova Scotia Health Authority Central Zone. I also have with me Dr. Alexandra Manning, Assistant Professor at the Department of Psychiatry at Dalhousie University. I also have with me Dr. Leanne Ravel. She's the fourth-year psychiatric resident, and they're all joining us here live on Newsdesk. Very great to have you on in the studio. Let's start with you, Prof. Let's start with Leanne, really, because you are at the receiving end of the whole initiative. How has it been so far for you?
It's been a delight coming to Ghana. Everyone's been so friendly and welcoming. We've had an opportunity to visit some of the sites in Accra, like the Kwame Nkrumah Memorial Park.
Oh, I see.
And also we've had very productive meetings. We've met with the College of Physicians and Surgeons, the Mental Health Authority, as well as leadership at University of Ghana Medical School.
Now, let me come to you, Doctor. Let me come to you. After Dr. Anne, you are Dr. Manning. Thank you so much. Let me come to you. Now, for this program, what are you looking to achieve?
Yeah, you know, we have a really excellent training program at Dalhousie University. We have a 5-year psychiatry residency program with very robust psychotherapy training and excellent subspecialty training in child and adolescent psychiatry, in geriatric psychiatry, as well as a number of fellowships. And I won't be sort of comprehensive in all of the ones we offer, but we offer training in early psychosis, mood disorders, forensic psychiatry, for example. But one of the areas that we really can improve on is transcultural psychiatry. And so that's one of the things that we're hoping to achieve in the collaboration with University of Ghana Medical School.
Now, let me come to you, Dr. Vincent, because we're looking at this program and the impact it's supposed to have on our sector with mental health care. What's your target in terms of the number of people you're hoping could receive this training program?
Yeah, so we are hoping to be able to help increase the number of subspecialty trained Ghanaian psychiatrists. And we are looking at areas like child psychiatry, forensic psychiatry, geriatric psychiatry. The goal will be to be able to train about 4 senior residents per year in these subspecialty areas. Each of them are receiving 6 months of international fellowship training at Dalhousie University. And as we said, it's not just a one-way training opportunity. It's also a two-way where some of our own residents from Dalhousie University would also come to Ghana and train in transcultural psychiatry. So that is a mutually beneficial relationship that's been developed.
So what are the main components of this specialization program?
So as I indicated, those who are going to Dalhousie will be there for 6 months. They would actually have a work permit, which means they are not just going on an observership. Usually people go on an observership and they are not able to touch patients or be involved in the care delivery of patients. This is actually a proper training program where the psychiatrists who go from here to Dalhousie University will be involved in the circle of care of patients and receive the same training that fellows in Dalhousie University receive as part of their training.
And how do you think this will enhance the skills of the Ghanaian psychiatrists?
Well, I've been here and I've seen how hard psychiatrists are working. People are going above and beyond caring for people, even with very minimal training. So the expectation is that we can be able to develop a critical mass of psychiatrists who have the skills, the knowledge, and the ability to provide the appropriate care that patients require. And also to serve as trainers for other trainees who are coming up. We are not hoping that we'll always be sending people abroad. We are hoping to develop the faculty here in Ghana so that they can be able to train much more people, so that there will be a multiplier effect to the collaboration.
Dr. Alexandra, now what key areas will this psychiatry program focus on?
So my focus really is with the psychiatry residents at Dalhousie University, and we want to be able to sort of build on the collaborative relationship and provide opportunities for our residents at Dalhousie to travel to Ghana and be able to work similarly with a hands-on approach, working directly in patient care, to be able to develop those skills in cultural psychiatry and transcultural psychiatry. In Halifax and in Nova Scotia in particular, our population is changing and we have more and more newcomers coming to Halifax and Nova Scotia, and that's something that our residency program just needs to work on.
You have been in Canada for a long time then coming into Ghana. What are some of the differences you've spotted with our healthcare delivery system here as compared to where you're from?
So that's a great question. I've been here for 2 days, and I think one of the things that I've noticed is really how hard psychiatrists here are working. We work hard at home as well, but the system is different and the access to care is different, and that's something that I think our residents could actually benefit from, the experience of working in that system.
Dr. Vincent, people are wondering, how do I get involved? Do I have to have, what qualification are you looking out for? What's the process?
So this is an institutional collaboration. So it's not one that any individual can actually apply. You have to work with the institutions in Ghana. So if you're a psychiatrist in Ghana, you work with the Ghana College of Physicians and Surgeons. They actually do the selection of those who then be interviewed by Dalhousie University and select. So far, we've had 7 people apply, 5 of whom have been offered positions with the international fellowships, and 1 has the application ongoing. So it's a good time for psychiatry in Ghana, and a good time certainly for Dalhousie University as well, in terms of the opportunity that we get to train our own people here as well.
So there's a gap, there's a deficiency when it comes to the number of people who actually practice psychiatric care and those people who are going through mental health issues. And I'm sure this is the reason why the program is there, to help bridge that gap. But how many people are you targeting to get on board with this initiative? I'm coming to you, Alexandra.
So again, my focus would be more on the residents who are going to be able to travel to Ghana. And our hope is really that this will be an equitable opportunity for all of our residents. We have an interest in transcultural psychiatry. Our resident body has an interest in that. And so we want to be able to support as many residents who are able and want to come to be able to do that.
Oh, that's beautiful. So we don't have any number. Can I be a part of it?
Well, if you went to the Ghana College and they accept you, then
Okay. But looking at mental health in Ghana, Dr. Vincent, I'm coming to you. Do you think that we've done enough in terms of healthcare delivery?
Well, I think those professionals who are working in mental health have gone above and beyond, let me put it that way. There's a lot more government can be able to do, which frankly is the gap that needs to be addressed. I mean, for example, up to date, mental health is not part of the National Health Insurance Scheme. There was a talk quite recently about including mental health care delivery on the National Health Insurance Scheme, but it's not translated into anything substantial. There are many people on the streets, even as we drove here, who frankly suffer from very chronic schizophrenia that need treatment and could have their quality of life improved if they had access to medication and other social supports. That's the responsibility of the government. So it's a failure of the government and of leadership. And I think these are things that civil society and religious bodies and everybody should rise up to really encourage the government to take up its own responsibility in this matter. I'll
come to you, Leanne, because you are an end beneficiary of this program. So far, how has the program been for you?
So we've had the opportunity at this point to visit the sites, the training sites, meet with the residents, and it's been wonderful to be able to engage with everyone that we hope to continue to collaborate with.
What are some of the key lessons you've learned so far, even with your short stay?
Everyone's been so kind.
Oh, wow. That's how we are here.
Yeah. Everyone's been so kind and welcoming, and I think at this point it's really just seeing the opportunity of how much we have to learn from all the trainers here, the trainees here, and I suppose it's just a feeling of excitement to hopefully to have the opportunity very shortly to be able to continue to collaborate.
Now I'll come to you, Dr. Alexandra. This program, you're telling me we don't have a number we're looking at. How long is this program supposed to be for? Is there a duration to it, or as long as you're in Ghana, we're free?
I think, another great question. We're really in the early stages of developing this. So when we sort of land back on Canadian soil, we'll be sort of engaging in stakeholder discussions there around how this can fit into our residency program and how we can continue that. I think, at the heart of any of these initiatives is the relationships. And one of the benefits of our visit here this time was the ability to really engage with the college, with the university here, the residents and the teaching faculty to foster that. I think the success of any of these programs is really at the heart of the relationships that sustain them.
Dr. Vincent, when I'm chosen, it's an all-expense-paid trip?
Well, as I indicated, they'll be on a work permit. So, I mean, we're going to treat them the same way as we treat our own residents.
Okay.
There'll be no distinction in terms of how much they are paid versus how much our own residents are paid. So, I mean, there's not going to be any cost to either themselves or to the other stakeholders in Ghana that are coming in. And we are going to fund our own residents to come here as well. So it's not going to be a burden on
That's good news.
In Ghana.
But walk us through the selection process. I know I have to be working in a government institution, but what's the selection process? Do I have to apply?
Yeah, so you should be endorsed by the Ghana College to travel for that experience.
Okay.
They are looking at qualifications like, for example, you should have completed your membership of the Ghana College. And we had discussions with the rector. They are expecting that you are in the fellowship training program and have submitted your research proposal so that whilst you are in Halifax or Dalhousie University, you can be able to get some support from researchers in shaping your research questionnaire and your research experience. So once the Ghana College have identified you as potential beneficiary, then you undergo an interview process with Dalhousie University, and that interview process is to ensure that the particular beneficiaries are a good fit for the team in Dalhousie as well. So far, it's been very positive experience. All of the people who've gone through the interview process have been declared fit, for the teams there. So that's really good, 100% success.
With this program, how many beneficiaries do we have so far?
So far, 5 have been offered placements, and there's 1 currently going through the system. The only individual that didn't qualify has been offered a place in Dublin as well, because Dublin is part of the collaboration, but he's gotten another opportunity in the United States. So far, I'd say almost everybody that's applied, there's an opportunity for them.
With some of your residents, Dr. Alexandra, I'm coming to you. What are some of the things they tell you they look forward to when coming to Ghana?
So this is very new. I think the experience of working in a different system is one of the, and Ghana is a beautiful country. So I won't lie that that's part of the attraction as well.
So we'll be monitoring this process, and we hope to get more people to get involved in it, because tackling mental health is actually key. Now let's go to the substantive issue, because you're all mental health practitioners in your various fields, apart from you, but you're practicing, so it means you're going to be a professional very soon. Mental health care in Ghana, I'll start with you, Dr. Vincent. How do you think our approach has been so far? Successful?
Well, I think successful to the extent that the resources allow. There's been a lot of initiatives and interventions over the years. Credit to Professor Asari, Professor Akwesi, Professor Sami, and many other people that have been involved. For example, as you probably be aware of, I think in 2007, 2008, there was an initiative with the Kintampo Training Center to increase the number of mental health practitioners. A program was set up to train community mental health officers and clinical psychiatric officers, so that each of the districts in Ghana would have at least some frontline mental health clinicians supporting identification and also the referral process for psychiatrists. I think that program has been very successful. I'm not sure if there's been a formal evaluation, but certainly it's increased the number of people who are getting access to care. There have been also initiatives to increase the number of psychiatrists. I think in 2010, we launched the Intermedical Students Public Speaking Competition in collaboration with St. Patrick's University Hospital. So far, we've had about 30 Ghanaian medical students go to St. Patrick's University Hospital to undertake 4 weeks, all expenses paid, electives.
Wow.
And that program is still ongoing. We are currently in the 11th year. Hopefully, we'll be having the 11th competition in January of this year. There have been also a lot of diaspora-based psychiatrists who come to Ghana to contribute to the training of our residents and also go to medical schools like Cape Coast University. Myself, I used to go to KNUST annually, to deliver lectures, and all that's helping to increase the number of workforce that we have within the mental health space. I think what's needed now is funding, increased government funding for mental health care delivery, so that the workers on the ground can be able to do more for the population.
Mental health issues, they know no color or gender, but unfortunately here in Africa, men find it quite difficult to express themselves and talk about their mental issues. I can see Dr. Alexandra nodding her head with that question. I will come to your thoughts about it, but how do you feel that we can encourage more men to express themselves and seek mental health care?
So we need to be very intentional about some of the initiatives that we put in place, And you are very right, women are more emotional and expressive, and therefore they seek help when they need to. Whereas men tend to kind of, bottle things within themselves. And usually by the time it comes to the stage where they are seeking help, then it's almost too late. That's why we have more men dying by suicide, compared to women. So it's important for us to look at social interventions. For example, forming social groups just for men, for example, will be a very good initiative, so that the men would know that if you are going through this, you are not alone. You know, there are many other people just like yourself who are going through it, and you can be able to seek help, at least first stage help. And when you go to such social groupings, you can be able to get information about access to support services that are beyond the social groupings and seek appropriate help and intervention. This is something that it's not just government that can be able to do. All churches can have men's group that's focused on the mental well-being of the men within their fold. And I think all of us working together, we can be able to make a difference that way.
I'll come to you, Alexandra, because you're from a different geographic location. When it comes to how men are treated with mental health, Doc made mention of special groups. Is this something you have over there?
Yeah, I was nodding along because I was just thinking that's a shared experience between with what we see in Canada as well. And there are more services I think that we're trying to develop to really offer support and collaborate with males in our population. I work more in child and adolescent psychiatry.
Oh, okay.
So I don't see that gender difference as prevalently within my practice.
In your area of practice, when it comes to children and adolescents, what are the key triggers to mental health issues?
Oh, that's a great question. I would say a lot of the psychosocial factors can be more common within our population, and also sort of the interactions with school and schooling and the school system.
I'll come to you, Leanne, because you are going to be specialized in this area. So far, with your interaction with people with mental health challenges, I'm sure as part of your program, you've been given that opportunity. What measures do you think we can put in place to better healthcare delivery with people with mental health?
I believe my colleagues have really touched on this, but education is really important, and with that, a focus on stigma around mental health is really important to encourage people to talk about it, to feel comfortable, and as practitioners, to be open and welcoming and supportive.
Stigma is a big issue we're facing here, Dr. Vincent, in Ghana. Do you think we've done enough to provide a safe space for people battling with mental health?
Well, I think a lot have been done. For example, you are aware of the decriminalization of suicide. It's been on our statute books for many years, and somebody experiencing suicidal ideation are thinking about going to jail. So, I mean, what's the point in talking about, their experience? Now people can be able to talk freely. There are a lot of social media activity going on. There's the mental health advocacy group that's doing a lot. The month of May was Purple Month in Ghana for mental health. The Mental Health Authority did a lot of engagement. And I think people are becoming more and more aware of mental health issues and the need to talk about it and seek help if the need arises, which is helping to address some of the stigma issues. It's not gone away completely, but I think a lot of work has been done.
Where do you think there are gaps in terms of our delivery, and what do you think can be done to fill in these gaps?
Resources are really where the gaps are. If there are more resources, there can be more work being done. And for example, talking about triggers of mental health, psychosocial factors are a big deal. If somebody is hungry, if somebody loses their job, they are unemployed, their kids have been thrown out of school, because they cannot pay their fees or provide daily necessities of living, no amount of medication can be able to help fix them if you don't provide the psychosocial supports that people need. So that's why I commend the government, for example, for the free education in high school. It's a major social intervention, free maternal care, free school feeding program. These are all very, very good initiatives that the government, I think, have put in place. But more of those things are needed for particularly the vulnerable in our society to help address the gaps, the remaining gaps that we have. And also coverage of medication. People cannot be able to pay for mental health medication because they are usually lifelong or you take it for many years. It's not like antibiotics where you take for just a few days. So if you have to be able to pay for that and you don't have a job, that's a very difficult challenge that many people are experiencing.
I agree. Now I'll come to you for your final words, Dr. Alexandra.
Just a big thank you to the University of Ghana, the college, for a very warm welcome and including us in the meetings this week.
Great. Dr. Leanne?
I'll say thank you as well, and in particular to the trainees, and really looking forward to continuing to collaborate with them.
And Dr. Vincent?
Yeah, and thank you to you for helping to spread the word about the collaboration. And obviously to my colleagues at the Mental Health Authority, the University of Ghana Medical School, the Ghana College of Physicians and Surgeons, and all the trainees and faculty that we've met on our journey. Everybody's been so receptive. And we look forward to a very long-term, fruitful collaboration, mutually beneficial for both institutions or countries.
Thank you so much for your time here on NewsX. We've been speaking to Dr. Vincent Ejapon. He's professor and head of the Department of Psychiatry at Dalhousie University and Chief of Psychiatry for Nova Scotia Health Authority Central Zone. Also, Dr. Alexandra Manning, Assistant Professor at the Department of Psychiatry at Dalhousie University, and Dr. Leanne Ravel. She's the fourth-year psychiatry resident here in Ghana, visiting us for the past few days. Thank you so much for your time here on NewsX. We're taking it.